Place the subject supine, with the knee flex to flatten the lumbar spine. Position the shoulder in 0 degrees of abduction, adduction, and rotation. Place the elbow in extension, so that tension in the long head of tricep muscle does not limit the motion. Position of forearm is 0 degrees of supination and pronation, so that the palm of the hand faces the body. Glenohumeral flexion. Stabilize the scapula to prevent posterior tilting, upward rotation, and elevation of the scapula. Shoulder complex flexion. Stabilize the thorax to prevent extension of the spine and movement of the ribs. The weight of the trunk may assist stabilization. Flex the shoulder by lifting the humerus of the examining table, bringing the hand up over the subject's head. Maintain the extremity in neural abduction and adduction during the motion. Slight rotation is allowed to occur as needed to attain maximal flexion. Glenohumeral flexion. The end of glenohumeral flexion, ROM, occurs when resistance to further motion is felt and attempts to overcome the resistance cause upward rotation, posterior tilting, or elevation of the scapula. The examiner stabilizes the lateral border of the scapula with her hand. The examiner is able to determine that the end of ROM has been reached because any attempt to move the extremity into additional flexion causes the lateral border of the scapula to move anteriorly and laterally. Shoulder complex flexion. The end of the shoulder complex flexion, ROM, occur when resistance to further motion is felt and attempts to overcome the resistance cause extension of the spine or motion of the ribs. The examiner stabilizes the subject trunk and ribs with her hand. The examiner is able to determine that the end of ROM has been reached because any attempt to move the extremity into additional flexion causes extension of the spine and movement of the ribs. Center fulcrum of goniometer over the lateral aspect of greater tubercle. Align proximal arm parallel to the mid-axillary line of the thorax. Align distal arm with the lateral midline of the humerus. Depending on how much flexion and rotation occur, the lateral epicondyle of the humerus or the olecranon process of the ulnar may be helpful reference. The alignment of goniometer at the end of glenohumeral flexion ROM. The examiner's hand supports the subject's extremity and maintains the goniometer's distal arm in correct alignment over the lateral epicondyle. The examiner's other hand releases its stabilization and aligns the goniometer's proximal arm with the lateral midline of the thorax. The alignment of goniometer at the end of the shoulder complex flexion ROM, more motion is noted during shoulder flexion than in glenohumeral flexion. Position the subject prone, with the face turned away from the shoulder being tested. A pillow is not used under the head. Place the shoulder in 0 degrees of abduction, adduction, and rotation. Position the elbow in slight flexion so that the tension in the long head of bicep brachii muscle will not restrict the motion. Place the forearm in 0 degrees of supination and pronation so that the palm of the hand faces the body. Stabilization for glenohumeral extension. Stabilize the scapula at the inferior angle or the acromion and coracoid process to prevent elevation and anterior tilting of the scapula. Shoulder complex extension. The examining table and the weight of the trunk stabilize the thorax to prevent forward flexion of the spine. The examiner can also stabilize the trunk to prevent rotation of the spine. Extend the shoulder by lifting the humerus of the examining table. Maintain the extremities in neural abduction and adduction during the motion. Glenohumeral extension. The end of ROM occurs when resistance to further motion is felt and attempt to overcome the resistance cause anterior tilting or elevation of the scapula. The examiner stabilizes the inferior angle of the scapula with her hand. The examiner is able to determine that the end of ROM's extension has been reached because any attempts to move the humerus into additional extension causes the scapula to tilt anteriorly and elevate, causing the inferior angle of the scapula moves posteriorly. Alternatively, the examiner may stabilize the acromion and coracoid process of the scapula. Shoulder complex extension. The end of ROM occurs when resistance is further motion is felt and attempts to overcome the resistance cause forward flexion or rotation of the spine. The examiner stabilizes the subject's trunk and drills with her hand. The examiner is able to determine that the end of ROM has been reached because any attempts to move the extremity into additional extension causes flexion and rotation of the spine. Center fulcrum of goniometer over the lateral aspect of the greater tubercle. Align proximal arm parallel to the mid-axillary line of the thorax. Align distal arm with the lateral midline of the humerus using the lateral epicondyle of the humerus for reference. Position the patient supine with a shoulder in lateral rotation and 0-degree flexion and extension so that the palm of the hand faces anteriorly. Glenohumeral abduction. Stabilize the scapula to prevent upward rotation and elevation of the scapula. Shoulder complex abduction. Stabilize the thorax to prevent lateral flexion of the spine. The weight of the trunk must assist stabilization. Abduct the shoulder by moving the humerus laterally away from the subject's trunk. Maintain the upper extremity in lateral rotation and neural flexion and extension during the motion. Examiner stabilize the lateral border of the scapula with her hand to detect upward rotation of the scapula. Alternatively, the examiner may stabilize the acromion and coracoid process of the scapula to detect elevation of the scapula. The examiner stabilized the subject's trunk and ribs with her hand to detect lateral flexion of the spine and movement of the ribs. Center fulcrum of goniometer close to the anterior aspect of the acromial process. Align proximal arm so that it is parallel to the midline of anterior aspect of the sternum. Align distal arm with the anterior midline of the humerus, depending on the amount of abduction and lateral rotation that has occurred. The medial epicondyle may be the helpful reference.
Position the subject's supine with the arm being tested in 90 degrees of shoulder abduction. Place the forearm perpendicular to the supporting surface and in 0 degrees of supination and pronation so that the palm of the hand faces the feet. Rest the full length of the humerus on the examining table. The elbow is not supported by the examining table. Place a pad under the humerus so that the humerus is level with the acromion process. In the beginning of the ROM, stabilization is often needed at the distal end of the humerus to keep the shoulder in 90 degrees of abduction. Toward the end of the ROM, the clavicle and coracoid acromion process of the scapula are stabilized to prevent anterior tilting and protraction of the scapula. Stabilization is often needed at the distal end of the humerus to keep the shoulder in 90 degrees of abduction. The thorax may be stabilized by the weight and the subject's trunk or with the examiner's hand to prevent the flexion or rotation of the spine. Medially rotate the shoulder by moving the forearm anteriorly, bringing the palm of the hand toward the floor. Maintain the shoulder in 90 degrees of abduction and the elbow in 90 degrees of flexion during the motion. Center the fulcrum of the goniometer over the olecranon process. Align proximal arm so that it is either perpendicular to or parallel with the floor. Align distal arm with the ulna using the olecranon process and ulnar styloid for reference. Rotate the shoulder laterally by moving the forearm posteriorly, bringing the dorsal surface of the palm of the hand toward the floor. Maintain the shoulder in 90 degrees of abduction and the elbow in 90 degrees of flexion during the motion. Center the fulcrum of the goniometer over the olecranon process. Align proximal arm so that it is either perpendicular to or parallel with the floor. Align distal arm with the ulna using the olecranon process and ulnar styloid for reference.